I think Australia is a multicultural society now. When you look back, like I said, even 20 years ago, the ethnics are really underrepresented. But now I think any industry probably has to acknowledge the cultural diversity, and it's in their interest to actually represent who we are. And it's I guess it's weird because when they actually talk about, so I read that study as well about diversity, and this is my take on things. Even when you come to simple things like skin color, one of the biggest differences I see is that Asians want to be white and Caucasians want to be dark. And when you look at,
and they still want this. So it's exactly the same conversation in 2022 as it was in 1981 when I immigrated as a dark-haired, dark-eyed girl who wanted to be blonde.
To be blonde, exactly. So when you look at Asians now, I think, I read that article as well. And then I'm thinking, man, it's like, I see it a little bit differently. I see there's a change in who I guess the minority want to portray as being part of the majority. So I understand. And and part of that report, I remember part of that report where there was some very, very low figures, and I'm pretty sure it's somewhere like 15 or 18% of ethnicities embrace their actual, it's important for them to actually embrace their ethnicities. And when I look at that figure, I think it's pretty damn low. I think,
but it's honest.
Yeah, it's honest, yeah, but I think it's really, really low. It's very low. And I guess that's part of the research where I'm struggling and go, it is, we want to be diverse, but then like you mentioned, they try to homogenize beauty, right? And that's where I think I struggle to understand the younger generation, especially.
So going back to this study, which says that, consumers felt that the beauty industry was really pitching everything to a Caucasian woman. And, we all agree that the Australian population is certainly way more diverse than we give it credit for. And that people feel confident, and it reinforces self-worth and belonging when they see someone similar to themselves in advertising, in ideals of beauty. And yet we have, countering that, the homogenization of beauty, which is occurring through, you were absolutely right, social media. There are more stars and more powerful influencers on social media than in Hollywood. They're actually reaching more people. So as a clinician, as a doctor, and you've got a huge social media influence and presence, definitely more so than I would say, most doctors in Australia. When someone comes to you and perhaps you sense a distorted sense of cultural identity or a distorted sense of a beauty ideal, do you feel it's your job as part of the consultation to help them come back to who they are and help them fall in love with their own unique, blueprint?
Yes, I mean, that's a good question. I actually start before the consultation. So when you look at my social media and you look at even, basically what I portray, it's never about, me giving, for example, XXL lips. Yeah, so it's not, or BBLs or what have you. So I kind of portray what I think is me, and what I think is, aesthetically pleasing, whether it be fillers, laser, surgical, whatever. So for me, it starts even before they come to see me, because that's who I portray myself. In the context of your question, yes, I do. I actually, for example, classically, even before we go to cultural, even things like lips, for example, I'm very uncomfortable giving big lips. That people might look at that and go, wow, that's really good. That's really nice. But I won't do that. That's why you don't see that in my social media. And all the stuff which I think is not aesthetically pleasing, I do not portray myself. And that's it. And for the patient coming in, hopefully they might see my profile and go, well, Davin's not the guy that's going to give me 1 mil in the upper lip and 1 mil in the lower lip and make me look like a duck, because I don't. But for the patient coming in, it's very hard because I do see on a daily basis, and it's about treading lightly as well, because the last thing I want to do is make them feel insecure or that they've had a bad decision. So when someone comes in and they've got something where it's not, either culturally or even aesthetically pleasing for that individual, I tend not to make that comment. The way I see it, especially when it comes to injectables, this is all the trends, much like a haircut, like, Kylie Minogue with the thin plucked eyebrows, arched in the
That's right. Yeah.
90s, yeah. So I think all of this, it's much like it's like everything else. It's just a trend, and hopefully I'm pretty sure that in the next couple of years you'll have more. In fact, I think it's happening now. You're going to have people there with more natural looks rather than actually super high chipmunk cheeks or trout pouts.
Do you think it's problematic that the age range for people who are having hardcore aesthetic treatment and spending a lot of money, because the spend creep, and I noticed in the report as well, is really getting up there. It was quite a significant portion of the population that spend over $200 a month on aesthetics. That's a lot for most household budgets. If you really think about it, that is a lot. 10 years ago, it would be quite luxurious if you got your nails done, or if you went out and had a blow dry, you probably would do it for special events. But it's not uncommon for people to have a lot of grooming, and if you're getting injectables, that's every 3 months. And if you're getting lasers, that's every 3 months or 6 months. So, people's budget on aesthetics is really stretching. Are you finding it alarming that, it's starting now in the early 20s rather than the mid 30s?
Yeah, so I guess there's 2 points with that. First, a lot of the spend, I think at least half the spend would be on skincare, right? And
Yes.
when I look at skincare, it's just, and I'll divide it into two. First of all, if it makes you feel good, and secondly, does it do anything? So I think nowadays, especially with this COVID stuff, a lot of people are treating themselves to feel good. So they might be spending a lot of money, like you say, $200 per month, but maybe out of that, $100, even more, will be in feel-good treatments. So you can use that feel-good treatment. Is it like going to a movie, or is it like having a nice dinner? Certainly by using skincare where you have self-gratification and go, well, you know what, that feels good, I'm doing something for myself. And I think that's okay, because it's not, it's not every single thing that you do for yourself, especially when it comes to aesthetic, might not be the thing which changes you, but you may actually feel really good about it.
Do you prescribe skincare? Is that part of what you do in your dermatology? And I know that you have, a clinical practice that's a lot of pampering treatments as well as clinical treatments.
So the answer to that question, most of the time I'm actually pulling out skincare rather than prescribing, because most patients that come to see me, generally speaking, will have pigment issues or rosacea or melasma or what have you, and they're using just too much crap out there. So in the end, I'm actually pairing out the skincare, and especially for sensitive skin, because I've got to say, hey, stop everything, just use a banal, moisturizer and a cleanser, and then build up from there. So I'm a really shit salesman, so I don't like to go there with, you got to buy this cleanser, toner, day cream, eye cream, night cream, all that sort of stuff. I just go keep it simple. I'm an old school derm from that point of view. So the answer to your question is that I don't usually promote skincare in that context. So even for patients who undergo resurfacing, we turn back time and the skin looks awesome. I'll say, look, let's start with a retinol, see how you go over the next 6 months, and then gradually add stuff in. But I know, basically there's a lot of sales out there that promote the whole range, but that's not, I don't do that.
Dr. Lim, if you were going to give advice to, the heavy uptake, the Gen Z who are really doing the most uptake on aesthetic treatment, and, going back to the point of diversity, what would be your advice to them in terms of starting and managing their aesthetic journey for the best possible results?
Well, I guess, like I said, there's two things: whether they want to feel good about the stuff they do at home to upkeep, and in that way, spend money on a simple skincare routine. the worst thing that someone can do is actually spend a lot of money and get worse skin. But that happens really commonly because people just buy too much and use too much. So for me, my best advice is, start simple. And it's always procedures over skincare. So when I mean procedures, it doesn't have to be a big laser resurfacing procedure. It can be something as simple as a chemical peel, right? In like a salicylic acid peel, if you have lots of acne, that can be a really, really good thing. And then someone who's, in their mid-30s, they don't have to spend big to get a laser procedure that, costs a couple of $100, but then that will do so much more than skincare. So always, it's much like my social media feeds, I always say be precise as to what you want. Don't buy a whole heap of stuff, try a whole heap of crap. Just be precise. If you've got a problem, come up with a solution. And the solution sometimes is super easy. Sometimes the solution is not using too much skincare. Your skin will be better off for it. Patients with rosacea, patients with sensitive skin. You don't have to put in, heaps of vitamin C, your retinol, your retinoids, because you'll end up worse than what you have. So I guess for me, it's just be precise. Sometimes when it comes to difficult cases like sensitive skin, you do need some help. Go see your dermatologist, spend that, $250, but then your skin will actually be much better off if you listen to them, much better off compared to you trying a lot of stuff and getting a worse outcome.